A beauty trend with over 6 billion views on TikTok claims that applying menstrual blood to your face can give you glowing, youthful skin. Some call it empowering, some call it a spiritual ritual. Dermatologists call it something else entirely. So what does the science actually say about putting period blood on your face? And why is the comparison to Kim Kardashian's vampire facial completely misleading? Welcome to Mind and Marvel, where we separate viral trends from valid science. Today, we're diving into one of the most controversial beauty trends to hit social media, menstrual masking. Also known as period blood facials or moon masking, this practice involves applying menstrual blood directly to the skin, usually the face, as a DIY skincare treatment. And look, I get it. This topic makes a lot of people uncomfortable, but that discomfort, that's exactly why we need to talk about it scientifically. Because somewhere between the stigma around menstruation and the hype of social media, there's actual biology happening. And understanding that biology is the only way to figure out whether this trend is revolutionary skincare or a risky pseudoscience experiment. Here's what we know. Hashtags like #NotJon period face mask have racked up billions of views. People are collecting menstrual blood in menstrual cups and applying it to their faces for anywhere from a few minutes to longer periods before rinsing off. Some practitioners describe incredible skin benefits, less inflammation, improved texture, a radiant glow. Others talk about it as a spiritual practice, a way to connect with their bodies and reject period stigma. The claims sound compelling. Menstrual blood contains stem cells, proteins, and growth factors that could rejuvenate skin. Advocates compare it to expensive medical procedures, like vampire facials, that celebrities swear by. And best of all, it's free and accessible to anyone with a menstrual cycle. But here's the critical question. Does any of this hold up scientifically? Are there actually beneficial compounds in menstrual blood? Can they penetrate the skin? And most importantly, is this safe? A recent analysis published by science educators and dermatologists calls menstrual masking the intersection of body positivity, cultural ritual, and pseudoscience. And that's the perfect description because this trend exists in a complicated space where empowerment, tradition, and unproven claims all collide. So let's break it down systematically. We'll look at what menstrual blood actually contains, examine the science behind the claims, compare it to legitimate medical procedures, and discuss the safety concerns that experts are raising. By the end, you'll have all the information you need to make your own informed decision about this viral trend. Let's start with the most fundamental question. What exactly is menstrual blood made of? Here's where things get interesting. If you ask most people what period blood is, they'll say, well, blood. But a fascinating study revealed that menstrual fluid is actually only about 34% blood. The other 66%? It's a complex mixture of other biological materials. So what makes up that other 2/3? Menstrual fluid contains sloughed-off endometrial tissue. That's the lining of your uterus that builds up each month and sheds during your period. It also contains vaginal secretions, cervical mucus, hormones, and various proteins. As this mixture passes through the vaginal canal on its way out of your body, it picks up additional elements, vaginal cells, cervical cells, and importantly, the microorganisms that naturally live in that environment. Now this is crucial to understand. Your vagina and cervix aren't sterile environments. They're home to what's called the vaginal microbiome, a community of bacteria, yeast, and other microorganisms that normally live there without causing problems. Some of these microbes are beneficial, others are harmless, unless they end up somewhere they're not supposed to be. This includes bacteria like Staphylococcus aureus, which commonly lives on skin but can cause serious infections if it enters through cuts or pores. It can also include various fungi and, in some cases, sexually transmitted infections if present. So when advocates say menstrual blood contains stem cells, proteins, and growth factors, are they right? Actually, yes, sort of. Let me explain. Research has identified something called menstrual blood-derived stem cells, or MNSCs. These are mesenchymal stem cells, a type of cell that can differentiate into many different cell types. In laboratory settings, studies have shown that mesenchymal stem cells from various sources can help heal skin by boosting collagen production, reducing wrinkles, and releasing growth factors that repair damage from burns, UV exposure, and wounds. MNSCs are actually being studied extensively in medical research. Because they grow easily in lab cultures and can develop into multiple cell types, scientists see them as a promising option for developing regenerative medicine treatments. Specifically, they're looking at using MenSCs to address photoaging. That's the premature aging of skin caused by long-term sun exposure. So the biological components are real. Menstrual blood does contain potentially beneficial substances. That part of the claim checks out. But, and this is a huge but, there's a massive difference between these substances exist in menstrual blood, and applying menstrual blood to your face as a topical treatment will deliver these benefits to your skin. Think of it this way: orange juice contains vitamin C, which is great for skin health. But that doesn't mean rubbing orange juice on your face is an effective skincare treatment. The vitamin C in skincare products is chemically formulated in specific concentrations and pH levels, designed to penetrate skin effectively. Fresh orange juice? Not so much. The same logic applies here. Yes, menstrual blood contains interesting biological components, but those components exist in an uncontrolled mixture, at unknown concentrations, combined with all the other elements we discussed, including potentially harmful microorganisms. And critically, there's no evidence that these components can effectively penetrate the skin's barrier when simply applied topically. The skin's outermost layer, the stratum corneum, is specifically designed to keep things out. That's its job. It's a highly effective barrier that prevents most substances from penetrating into the deeper layers, where they could actually have beneficial effects. This is why legitimate skincare products use sophisticated delivery systems, specific molecular weights, and chemical formulations designed to get past this barrier. So while menstrual blood does contain stem cells and growth factors, there's currently zero clinical evidence that applying it topically delivers any of those potential benefits to your skin. One of the most common arguments for menstrual masking goes something like this: if Kim Kardashian can get a vampire facial using her own blood, why can't I use my period blood for the same benefits? It's a reasonable question, and the answer reveals a lot about why understanding medical procedures matters before trying DIY versions at home. Let's talk about what a vampire facial, technically called platelet-rich plasma therapy or PRP, actually is and how it works. In a professional PRP treatment, a medical provider draws a small amount of blood from your arm, just like a regular blood draw. That blood is then placed in a specialized FDA-approved centrifuge that spins it at high speeds. This spinning separates the blood into layers based on density. What the provider is looking for is the platelet-rich plasma layer, a concentrated portion of your blood that contains high levels of platelets and growth factors. Platelets are tiny cell fragments that play a crucial role in healing. When you get a cut, platelets rush to the site and release growth factors that trigger tissue repair. In a PRP facial, these concentrated platelets and their growth factors are being used to stimulate collagen production and skin regeneration. But here's the critical part: the PRP is prepared under completely sterile laboratory conditions. The blood never touches anything non-sterile. The centrifuge is medical grade, and the resulting PRP is then applied to the skin using microneedling, a procedure that creates thousands of tiny channels in the skin, allowing the PRP to actually penetrate into the dermis where it can have effects. Some providers also inject PRP directly into specific areas using fine needles. Either way, the procedure is performed by trained medical professionals in clinical settings, and it can cost thousands of dollars. Now let's contrast that with menstrual masking. Menstrual blood is collected in a menstrual cup after sitting in the vaginal canal, an environment full of microorganisms, as we discussed. It contains not just blood but endometrial tissue, mucus, hormones, bacteria, and yeast. It hasn't been centrifuged or concentrated, it hasn't been sterilized, and it's simply smeared onto the face and left to sit on the skin's surface. There's no microneedling, no sterile preparation, no concentration of beneficial components, no professional medical oversight. As one physician put it bluntly, menstrual blood would not contain such a high concentration of platelets. It still contains red and white blood cells, and it is merely smeared onto the face, not injected. The two treatments are entirely different. Think about it like this: both treatments involve blood. That's where the similarity ends. It's like saying swimming in a pool and swimming in the ocean are the same because both involve water. Technically true, but practically very different experiences with very different risks. The vampire facial you see celebrities getting involved. Sterile blood draw, laboratory centrifugation, concentrated platelet-rich plasma, professional microneedling or injection, clinical setting with trained providers, costs thousands of dollars. Menstrual masking involves non-sterile collection, no processing or concentration, raw mixture of blood and other fluids, surface application only, DIY at home, free. Another critical point, PRP works because it's delivered into or through the skin where the growth factors can actually interact with skin cells. Just sitting on the surface? That's not how these biological molecules work. Dr. Geeta Yadav, a board-certified dermatologist, explained it perfectly. Menstrual blood facials are not administered comparably to a PRP or vampire facial, which uses microneedling devices to push the nutrients deep into the skin where they can be effective. And here's something that really matters. Because PRP is a medical procedure, it's regulated. Devices are FDA approved. Providers are licensed. There are standards for sterility and safety. If something goes wrong, there's medical backup and liability. With DIY menstrual masking, you're entirely on your own. And that brings us to our next critical topic, safety concerns. Okay, so we've established that menstrual masking isn't comparable to professional PRP treatments, but what about safety? Could it actually be harmful? This is where dermatologists and infectious disease specialists are raising red flags, and their concerns are backed by solid microbiology and dermatology principles. Remember how we talked about the vaginal microbiome, all those bacteria and fungi that normally live in the vaginal canal? Those microorganisms are perfectly fine where they are. Your vagina is equipped to handle them. But your face, that's a different story. As Dr. Deborah Lee explains, when you apply menstrual blood to your face, you're transferring these microbes along with it, and they can enter your body through any small breaches in your skin barrier. On your face, these could be microabrasions, tiny scratches you don't even notice, acne lesions, areas of inflammation, even the microscopic openings of your pores. They can also enter through your mucous membranes, your eyes, nose, and mouth. If you're applying blood to your face and any gets near these areas, you're creating pathways for bacteria to enter your body. One of the most concerning bacteria commonly found in vaginal flora is Staphylococcus aureus. This bacteria lives harmlessly on skin surfaces most of the time, but when it gets into the deeper layers of skin through a cut or pore, it can cause serious infections. Everything from minor skin infections to potentially dangerous staph infections. And here's something many people don't consider. If you have any sexually transmitted infections, even if you're asymptomatic and don't know it, those pathogens could be present in your menstrual blood. Dr. Hayes raised this alarming possibility. How would you like to learn you have a sexually transmitted infection by waking up one morning post-period facial to chlamydial conjunctivitis or a herpes outbreak on your face? That's not fear-mongering. That's basic infectious disease biology. Pathogens go where you put them, and putting them on your face, near your eyes, nose, and mouth, creates opportunities for infections in places where infections can be serious. There's also the issue of cross-contamination in shared spaces. Dr. Lee points out that these microorganisms can survive on surfaces, taps, shower heads, toilet handles, sinks, basins. If you're doing menstrual masking in a bathroom shared with family members or roommates, you could potentially be exposing them to these pathogens as well. Now I want to be clear, menstrual blood isn't inherently toxic or dangerous when it's in your menstrual cup or on a pad. We're not talking about hazardous waste here, but context matters. These fluids exist in a specific biological context, and moving them to different parts of your body, especially your face, changes the risk profile entirely. Let's also talk about what's missing from this trend: standardization. There's no agreement on how much blood to use, how long to leave it on, how often to do it, or any other parameters that would allow us to assess safety or efficacy. Some TikTokers leave it on for a few minutes, others for much longer. Some do it monthly, others more frequently. In legitimate medical treatments and cosmetic procedures, dosing and frequency matter enormously. Too little of an active ingredient and you get no benefit. Too much or too frequent, and you can cause harm. With menstrual masking, there are zero guidelines because there's been zero clinical research. And that's the fundamental problem. This is an uncontrolled experiment being conducted on people's faces with no safety data, no efficacy data, and no medical oversight. Compare this to how new skincare products are developed. Before a cosmetic product hits the market, it goes through extensive testing. Companies test for skin irritation, sensitization, toxicity. They standardize formulations. They conduct clinical trials to demonstrate safety and efficacy. They package products in ways that prevent contamination. None of that exists with menstrual masking. You're essentially using a raw biological fluid in a completely uncontrolled way. Dr. Yadav summed it up. Aside from the fact that it is free, there is zero advantage to using menstrual blood on your skin, and multiple dermatologists have stated flatly that they do not recommend this practice. Now, here's where this conversation gets nuanced, because menstrual masking isn't just about skincare, it's also about body positivity, cultural practice, and rejecting period stigma. Many practitioners describe menstrual masking as deeply meaningful to them. They talk about connecting with their bodies, honoring their menstrual cycles, and participating in what they see as ancestral feminine rituals. For some, it's an explicit rejection of the shame and stigma that has surrounded menstruation for centuries. And that's valid. The cultural taboo around periods is real and harmful. Women and people with menstrual cycles have been taught to hide, sanitize, and feel embarrassed about a completely normal biological process. Movements that challenge that stigma and encourage body acceptance are important. Some practitioners trace menstrual masking to traditional practices. In the Philippines, there's a folk belief that washing your face with period blood during puberty will prevent acne. Other cultures have various rituals involving menstrual blood that carry spiritual or symbolic meaning. When practitioners talk about feeling empowered, connected to their lineage, or more in tune with their bodies, those are genuine psychological and spiritual experiences. The question isn't whether those feelings are real, they are. The question is whether menstrual masking is an effective or safe way to express those values. And this is where we need to separate symbolism from science. Something can be personally meaningful without being scientifically validated. A practice can feel empowering without being medically advised. As the recent scientific analysis put it, menstrual masking sits at the intersection of body positivity, cultural ritual, and pseudoscience. For some, it's a celebration of the menstrual cycle and a rejection of stigma. For others, it's an unproven and potentially risky beauty trend. There are ways to challenge period stigma and celebrate menstruation that don't involve applying biological fluids to your face. You can normalize conversations about periods. You can reject shame without engaging in potentially risky practices. Body positivity and scientific caution aren't mutually exclusive. The concern isn't that people are talking openly about periods. That's great. The concern is that a practice without scientific backing is being promoted as having skincare benefits it hasn't been proven to deliver, and that carries risks that aren't being adequately communicated to people trying it. And honestly, some practitioners have beautiful skin, but beautiful skin doesn't prove causation. People who are interested in skincare trends probably already take good care of their skin. They might have good genetics. They might be using other effective products. Attributing their skin quality to menstrual masking without controlled studies is classic correlation versus causation confusion. The bottom line, you can honor your body and reject period stigma without doing menstrual masking. And you can question the safety and efficacy of a viral trend without being anti-body positivity or pro-stigma. So, if menstrual masking isn't backed by science and carries potential risks, what are evidence-based alternatives for people interested in skin rejuvenation? If you're intrigued by the concept of using your own biology for skincare, the professional vampire facial, PRP therapy, is a legitimate option. It's expensive, yes, ranging from hundreds to thousands of dollars depending on where you live and how many treatments you get. But it's performed under sterile conditions by licensed professionals using medical-grade equipment and techniques that actually deliver growth factors into the skin. If PRP is out of your budget, there are plenty of evidence-based skincare ingredients that actually work. Retinoids, for example, are gold standard for anti-aging. They increase cell turnover and boost collagen production. Vitamin C serums, when properly formulated, can brighten skin and provide antioxidant protection. Hyaluronic acid helps with hydration. Niacinamide can improve skin barrier function and reduce inflammation. These ingredients have decades of research behind them. We know they work. We know their safety profiles. We know how to use them effectively. If you're looking for at-home facial treatments, there are so many options that are both safe and effective. Honey and avocado masks for hydration, clay masks for oil control, gentle chemical exfoliants like lactic acid or glycolic acid for texture improvement. And if your primary motivation is body positivity and connecting with your menstrual cycle, there are beautiful ways to do that without the health risks. period tracking apps that help you understand your cycle, menstrual art projects if you're creatively inclined, conversations that normalize periods, supporting policies that provide menstrual products to people who need them. The key message here is, curiosity about unconventional approaches is fine. Skepticism about mainstream beauty industry claims is healthy. But viral trends aren't automatically better just because they're natural or DIY. Science matters, safety matters, evidence matters. As experts concluded, the biological richness of menstrual blood is undeniable, but its safe and effective use belongs in controlled medical research, not in DIY skincare routines. And there you have it, the complete scientific breakdown of menstrual masking, one of social media's most controversial beauty trends. Let's recap the key points. Yes, menstrual blood does contain stem cells, proteins, and growth factors that are biologically interesting. Scientists are actively researching menstrual blood-derived stem cells for future medical applications, but that doesn't mean applying raw menstrual blood to your face is an effective skincare treatment. The comparison to vampire facials is misleading. Professional PRP therapy uses sterile, concentrated platelets delivered into the skin through microneedling or injection. Menstrual masking uses unsterile biological fluid, simply smeared on the skin's surface. They're not comparable. Safety concerns are real. Menstrual blood can carry bacteria, fungi, and potentially STI pathogens that can cause infections when transferred to facial skin, especially through any small breaks in the barrier or near mucous membranes. And while body positivity and challenging period stigma are important, and we should absolutely be having more open, shame-free conversations about menstruation, there are safer and more effective ways to do that than this particular practice. As with many viral health trends, the lesson here is to distinguish between what feels empowering and what's actually scientifically sound. Something can be personally meaningful without being medically advisable. If this deep dive into viral beauty trends and the science behind them was helpful, I need you to do 3 things. First, hit that like button. It helps us reach more people who want evidence-based information about health trends. Second, subscribe to Mind and Marvel and turn on notifications so you never miss our breakdowns of the latest scientific developments. And third, drop a comment. What other viral health or beauty trends should we investigate? What questions do you have about skincare science? Thanks for watching, Curious Minds. Until next time, stay curious, stay skeptical, stay safe, and keep marveling at the difference between viral trends and validated science.